Cavity Free at 3 is a program for training medical and dental teams to be able to provide oral health preventive services for expectant moms, infants, and toddlers.
So I think a lot of primary care pediatricians don't realize that there are national guidelines for dental care for infants, toddlers, and pregnant women. And there's huge disparities in these groups. The Cavity Free at 3 service model is actually a program designed to help doctors and pediatricians and dentists talk to their patients about cavity prevention.
Medical and dental providers can portray the message that it is safe for a pregnant woman to receive dental care at any point during her pregnancy. Early childhood caries is something that it's incredibly common. It affects so much for a younger population. It's the #1 chronic condition in childhood. But the most important thing to know about early childhood caries is that it is entirely preventable.
So preventative health care is a big part of pediatrics, and we do it already. We do it about smoking, we do it about weight loss, exercise, and it just takes another minute to talk about oral health with the Cavity Free at 3 program.
The Cavity Free at 3 team provides a forum for dentists and pediatricians to all come together, share ideas.
The model has training for the dentists and the physicians. There's these pamphlets that we can give out. They help us with our billing.
Another big part of the training was guiding dental and medical providers on how to effectively implement a caries risk assessment and how to put it into the EHR messaging so that we can effectively code it to Medicaid and receive reimbursement.
Since 2008, over 4,000 people in Colorado have been trained in the Cavity Free at 3 model. The Cavity Free at 3 training model includes caries risk assessment, clinical evaluation, fluoride varnish application, anticipatory guidance, goal setting, and establishment of a dental home. Unfortunately, over half of the children entering kindergarten have already experienced cavities. But this number goes up if those children are from low-income communities. If you're in a low-income community as a child, you're over twice as likely to have cavities as you are in a high-income community. That's a disparity that should not occur, and we can do something about it.
My name is Judith, and I have 2 little girls. I think that what surprised me the most for Elena was that she needed to go for her first checkup that early. I think that I took Elena for her first appointment before she turned 1. My pediatrician and dentist do a really good job at collaborating care for my children, and the dentists always make it fun for them.
Here's what we can provide: free training for medical and dental providers and their staff, hands-on coaching and the opportunity to learn in the peer-to-peer setting, medical provider certification required by Medicaid for billing, startup kits including fluoride varnish and printed resources, an easy and convenient process for ordering the supply kits, ongoing technical assistance for providers and their practices, access to a suite of resources to provide anticipatory guidance and ongoing care.